Hello everyone, this is Dr. Tidman. Thanks for stopping by my channel. Remember to subscribe and hit the notifications so you'll be informed of my future videos. Today's video is part 3 of a 5-part series on Caregiving 101. Today is entitled Long-Term Care and Skilled Care, and what are they exactly? I covered a little bit of this in part 2, so if you haven't seen part 2, go back and check that one out. It's on my channel. And then of course part 1 really laid the foundation for the series, so be sure to check out part 1 as well. So this series is based on my 45 years in healthcare experience as an occupational therapist and on my 2 books. The first book, Families in the ICU, a survival guide, and its sequel book, Families in the Rehab Center and Beyond. Both of those will have links to purchase on Amazon in the description below. And of course, I'll put my email address if you have any questions. This series really was created based on the fact that I feel that families are very misinformed or uninformed about what their options are when it comes to moving a family member from the hospital who may not be ready to go straight home. You have lots of options and you have lots of power, let's call it, to help make those decisions. So you're going to really hear that I have a passion for my poor families that really don't get a lot of explanation on some of this. So be sure to check in on Mondays, and I'll be posting the other parts of this series. So I'm going to talk a little bit about rehab. I covered it a lot in part 2. What is a SNF? What is an LTAC? Okay. Engaging the staff, some terminology, discharge planning, and some final tips and takeaways. So what is SNF? You hear them call it SNF. It is a skilled rehabilitation facility. It's really meant to be short-term, and many of these facilities are in the same building as nursing homes are. They really share the facility, but typically they'll have one entire floor or wing that's dedicated to those that are planning to go home and just need some rehab. Now, based on your insurance coverage, if you're Medicare, you have up to 100 days, as I pointed out in part 2. But after 20 days, you have a copay, so be sure that you know what your coverage involves. So what is a long-term care facility? This is more of a dependent living situation. This is for people who don't have an option to go home. Maybe they live alone, or they've had a pretty significant illness or injury. So long-term care facilities don't offer a lot of rehab, if any. And it really makes a difference on if you have Medicare Part B. So you need to really look into your coverages now and be sure that you have Medicare Part B. Now, Part B is something you pay for every month. So if you have Medicare and you're not paying anything, chances are you have Part A. That's offered to all United States citizens after a certain age. Again, to review, skilled rehab criteria are you have to be able to participate in 2 to 3 hours per day of therapy. The first 20 days, there's no copay. After 20 days, there's a 20% per day copay. And you have to qualify for an extension. So what does that mean? Ways to qualify to stay longer in your rehab is steady progress on your therapy evaluations and goals. You need to be out of bed most of the day, moving around. You can't spend the day in bed and expect to really attain your goals. You have to be able to perform to your prior level before your accident, injury, or illness. And you have to have a stable discharge setting with support. In other words, if you live alone or you're homeless, this is going to be taken into consideration when they're trying to decide your discharge plan. By the way, you can participate in the decisions. They are not allowed to just tell you where you're going. So you need to be, and your family needs to be, actively involved in that decision-making process. Long-term care, once again, limited to no rehabilitation is available. You may be able, on a case-by-case, very short-term basis, to be evaluated by the rehab staff. You will probably have a very limited ability to return to your prior level of function, or maybe limited social or home support is available for you. We call that an unstable discharge setting. In this case, you may need to work on qualifying for Medicaid, because many long-term care facilities you have to pay for out of pocket, and they're quite out of reach. It's not unheard of to have a month in long-term care cost $15,000 to $20,000. So some people are fortunate enough to have gotten long-term care insurance. Long-term care insurance, their qualifications vary, their coverages vary, and they're quite expensive. But some companies offer long-term care insurance to their employees. If they do, I would highly recommend that you take out a policy. Most of these policies have a cap or limited coverage criteria. That could be a per year cap or a lifetime cap. So you need to know what your coverage includes. You must have a documented need through evaluations by the therapists at the receiving agencies for your long-term care insurance to kick in. Some insurance companies that have long-term care will waive the monthly premiums while you're in a facility, but some do not. So you need to know what your coverage is. It's terrible to be in a facility and get hit with bills for your long-term care insurance. Be sure day one, with your admission to a rehab facility, that you contact and work with the social worker in that facility who knows your eligibility for different coverage assistance. They're going to be the ones who coordinate reports and evaluations from the therapy staff. So get to know the social worker in your facility right away. Some facilities call them discharge planners. Most of them are social workers. Final tips. Have I said this in every video? Have a power of attorney and have it with you. Bottom line, that is your most important document. If anything you learn from this series, remember Dr. Tidman saying, get a medical power of attorney on your family member and have it with you. In the hospital, in the rehab center. It's going to be your lifeline, believe me. Have copies of your insurance policies and what they cover. Call your insurance carrier. Find out what they cover. Coordinate with the social worker on these coverages and any discharge planning. Get written reports from the therapy staff. Yes, they can provide them. Get copies of their notes. Yes, they should provide them. They'll look at you like you have two heads when you ask for it, but they have them. They need to print them out and give you copies of them. Have a clear discharge plan in mind and communicate this with the therapists and the social worker. If going home, request a home safety evaluation from the therapists. Some facilities will actually send those therapists to the house to evaluate what's there and what is needed to meet the needs of your family member before they go home. I used to do these all the time. They were so much fun. I loved going into a home and helping a family get it set up for their family member. Thank you for stopping by my channel. Remember to subscribe and hit the notifications so you're informed of the next posting of videos. Typically, I'm posting videos every Monday. This was part 3. Part 4 will be posted next Monday. This is my email address, and then I'll put links to my 2 books in the description. See you on the next video.